One of the biggest anxiety-provoking moment if your period is late. You've taken one, two, three pregnancy tests, all of them are negative. But then you're sitting there wondering, what is going on with my body? Something wrong? Am I pregnant? The test just missed it? Is there something more dangerous or more serious happening? Just take a deep breath. Today we're going to walk through exactly what can cause your period to be late while you're still having a negative pregnancy test. Before we dive in, if this is the first time on my channel, welcome. I make videos every week about female health, sexual health, healthy living, all grounded in evidence-based medicine. I also offer private health coaching sessions and live Q&A where you can talk directly to me, ask questions or specific concerns. The link is in the description below. I'd love to work with you one-on-one. So we'll start with some basics because understanding the cycle is foundation of everything we're going to talk about today. Typical menstrual cycle runs anywhere between 21 and 35 days. Day one is the first day of your period. Most people think a normal cycle is exactly 28. That's a myth. There is a big range of what's normal. So here's what's happening behind the scenes. Like the first part of the cycle, it's called the follicular phase, which your brain sends a signal to your ovaries to mature an egg. Estrogen goes up, lining of the uterus starts thickening in preparation. Phase number two is ovulation. This is midpoint of the cycle. Mature egg is released, and this is the only window which you can get pregnant. So roughly 24 hours. However, sperm can live up to 5 or even 6 days. This is why the fertile window is probably like 6 days or even 7 days in total. And then the third phase is the luteal phase, which is after ovulation. Your body produces progesterone, which maintains the uterus lining. And when there's no fertilization of the egg, you don't get pregnant. Progesterone drops, the lining of the uterus sheds, you get a period. So when we talk about a late period, what we're really talking about is there's a disruption somewhere in that sequence. And there are many reasons that can happen. Most of them actually have nothing to do with pregnancy. So let's define a late period. Late is clinically considered late if it hasn't arrived within 5 days of when you expect it, based on your usual cycle. It's considered a missed period if it hasn't come within 6 weeks of your last period. So if your cycles are irregular to begin with, meaning they vary by more than 7 to 9 days from month to month, then you can't really predict. So here's an important fact. Pregnancy tests are more accurate when taking at least 1 day after a missed period. The test detects a hormone called HCG, which is produced after a fertilized egg is implanted into the uterus. So if implantation happened late in your cycle, the levels of HCG might not yet be high enough to detect, even on a quality test. So if you tested very early, you should definitely retest again. But if you've tested multiple times days apart and the results are consistently negative and your period is still not here, then we need to look up on other explanations. So one thing that can actually make periods late is stress. Stress is number one non-pregnancy cause of a late or missed period. And it's profoundly underestimated. When your body is under physical or emotional stress, it releases cortisol, your stress hormone. And elevated cortisol directly interferes with your hormonal balance, which is the communication system between your brain and your ovaries. What is the result? Ovulation is delayed. It can be skipped altogether. No ovulation means no progesterone drop, means no period. This can happen after major life events, a breakup, divorce, job loss, a death in the family, sometimes even academic exams. Your body's not broken, it's just responding to its environment. Another cause, it can be significant changes in your weight or exercise. So your body needs a certain percentage of body fat to maintain hormonal function and menstruation. So rapid weight loss, extreme dieting, or sudden significant increase in intense exercise can suppress ovulation and stop your periods completely. So this is a condition called amenorrhea or hypothalamic amenorrhea. And it's more common than people realize, particularly in athletes and women with very low BMI. It is reversible, but it does require medical attention. PCOS is also one of the most common hormonal disorders in women, affecting about 10% of women of reproductive age. It's characterized by irregular or absent periods, elevated androgen levels, which are the male hormones. They can have some small cysts on their ovaries visible on ultrasound. Women with PCOS do not ovulate regularly, which means their cycles are unpredictable and often delayed. So if your periods have always been irregular and you've had other symptoms like acne, excessive facial hair, or difficulty losing weight, PCOS should be evaluated. Another cause of late periods is thyroid disease. Why? Because thyroid gland or your thyroid hormone regulates your metabolism, but it also plays a direct role in menstrual regulation. So an underactive thyroid or an overactive thyroid can cause irregular or absent periods. Thyroid conditions are extremely common in women. However, a simple blood test like a TSH level can detect the problem. Also, if you're experiencing fatigue, weight changes, feeling cold or hot or palpitations, bring it up to your provider because that might be a sign of thyroid disease. Something else I want to discuss is perimenopause. So if you're in your late 30s or 40s, your ovarian reserve, which is the number of eggs you have remaining, is naturally declining. As this happens, the estrogen levels, they can fluctuate a lot and cycles start becoming irregular. It's called perimenopause, which is a transitional phase before menopause. It can begin as early as late 30s. You may experience missed periods, shorter or longer cycles, disrupt sleep, hot flashes, mood swings, which leads us to something called premature ovarian insufficiency. This is less common but important to mention. This is something called premature ovarian failure. Occurs when the ovaries, they stop functioning normally before the age of 40. So women with this condition, they have high FSH levels, low estrogen, and they can have irregular or absent periods. It's not the same as early menopause in every case. Some women with this problem will still ovulate. However, it does require medical evaluation and management, particularly regarding long-term cardiovascular health and bone health. Lastly, I want to talk about medications because certain meds, they can affect your ovulation, like antidepressants, blood pressure medications, chemotherapy agents, even some over-the-counter drugs. So if you recently started a new drug, make sure you talk to your doctor and ask about the side effect profile because some of them, they can affect your periods. Okay, so when do you need to see a doctor? These are the situations that you might want to seek medical evaluation. If your period is more than 3 months late and you're not pregnant, if you have missed 3 or more periods in a row, if you're experiencing severe pain, fever, unusual discharge alongside a missed period that could be an infection, you have symptoms of thyroid disease like we discussed, fatigue, weight changes, temperature sensitivity, hair loss, palpitations. If you're under the age of 40 and you're experiencing vaginal dryness, hot flashes, irregular periods, night sweats, that can suggest premature ovarian insufficiency. Also, if you've been trying to conceive and your cycles are consistently irregular, just remember the important things from today. Late period with a negative pregnancy test is extremely common. Doesn't mean you're pregnant. Most of the time has a benign treatable explanation. Like we discussed, there is a lot of things that can cause this problem. And also, if you test it very early, the HCG may not be yet detectable. So retest 1 week after you missed your period with first morning urine for best accuracy. If you found this video helpful, please give it a thumbs up, subscribe to my channel. I release weekly videos about healthy living, pelvic health, pelvic wellness, sexual health. If you have any questions, feel free to book a session with me below. I offer direct health coaching sessions. Thanks for watching. I'll see you in the next video. I'm Dr. Peter Aziz.